Hi, I'm Pamela Cipriano. I'm a doctorally prepared nurse practitioner coming to you from the Practice of Health and Wellness in Thomaston, Connecticut to discuss why some people get symptoms years after a tick bite. So the way a tick bite works is, first of all, the ticks are very tiny. They have sticky feet, so they're able to climb on you without you even noticing anything's climbing on you. When they bite you, it has an anesthetic quality to it, so you don't feel the bite like you would with a mosquito. And unlike a mosquito bite, when you do get bitten by a tick, your immune system doesn't have the ability to respond immediately, so you don't get that hive or boil or itchy area like you would with a mosquito bite. And there's a reason for this. The bacteria is located in the stomach of the tick. When the tick bites you, it regurgitates the contents of the stomach, which come up and out through the mouth. The bacteria is covered in the saliva, and that saliva causes the bacteria to be hidden, incognito, to your immune system. It has a good 2-week head start before your immune system realizes that there's something in there that doesn't belong. Within 24 hours of getting bitten, the bacteria uses your proteins to create a biofilm. A biofilm is like a tunneling or housing system inside your body where persister cells and immature bacterial cells will reside. If your immune system is strong, they can reside in your body for decades without any symptoms whatsoever. However, there's always a trigger. And that's the reason why there is a correlation between Lyme disease and fibromyalgia. Because like Lyme disease, fibromyalgia needs a trigger that decreases your immune system. So with Lyme disease, 10 years after a bite, no issues whatsoever, and then something happens that's very traumatizing to you, whether it's an illness, surgery, car accident, death of a loved one, something that really rocks your world, you're going to end up with a decreased immune response. This is the time when the biofilm breaks open and your body is infiltrated with the bacteria, billions of bacteria. And you go from very healthy to very sick, literally overnight. You can have things like brain fog, joint pain, fevers, skin irritation, rashes. You can have burning sensation down your legs, burning sensation under your feet, difficulty hearing, difficulty speaking, difficulty reading or understanding the spoken word. And the list goes on. And everybody is different. Depending on where the bacteria resides, it will generally reside in one area of the body, whether it's the bladder, if it's the nervous system, if it's the musculature, if it's the joints. And like I said, everyone is different. It's very difficult to diagnose chronic Lyme disease because at this point, your immune system is literally in the toilet. And the way testing is right now, the testing checks your immune system's ability to identify that you have a tick-borne disease. So if your immune system is not working to par, you're not going to be able to get a positive result. The problem with this is many times Lyme disease is misdiagnosed as MS. Bartonella, which is a co-infection, is many times misdiagnosed as Parkinson's disease. This can be problematic when you're not getting the proper treatment. You're getting treatment for something you don't really have, and you're getting worse and worse and worse. At the Practice of Health and Wellness, I am a trained provider in acute Lyme disease, chronic Lyme disease, and chronic illness. My certification is acute care nurse practitioner, so I thrive on the difficult cases that I get. As a nurse practitioner, I've worked as a hospitalist in the Department of Surgery and in the Department of Medicine. I've worked in the emergency department. I've worked in urgent care. I've worked in areas that you really need to understand the anatomy and physiology of the body and be able to think critically. So, if you feel like you may have a chronic illness or you think you may have chronic Lyme disease, please give the office a call. We're located in Thomaston, Connecticut. You can reach us at 860-880-2525, and please visit us on our website at thepracticeofhealthandwellness.com. I really want to make you better. I hope to see you soon.